Welcome to Now Serving a Site of Therapy, a client's introductory guide into the therapeutic world. Be sure to follow, subscribe, and comment on YouTube, Spotify, and Apple Podcasts. To schedule a therapy appointment, call us at 650-223-5065. For more information on this and other related topics, check out our blog at isotherapy.com, where you can also contact us through our website. I'm your host, Dalton Huckabee, a licensed marriage and family therapist, and I'm grateful you've joined me. Welcome to this week's episode of Now Serving a Site of Therapy, a client's introductory guide into the therapeutic world. Today, we are joined by Pearl Chen and Marilyn Fernando from the San Mateo County Pride Center. Pearl received her master's degree in social work from San Jose State University with the focus on families and children, and is now working toward becoming licensed. She's inspired by the determination and drive of those who are in marginalized communities, and guides individuals by talking through grief and shame, as well as taking a strengths-based approach. When not working, she enjoys volunteering at LGBTQ plus community events, nerding out, and hosting panels at comic conventions and spending time outdoors with her dog. Marilyn is marketing and community engagement lead at the San Mateo County Pride Center. She is a first-generation Filipina American who has worked as the marketing and community engagement lead at the SMC Pride Center since 2019. She started her work in community organizing as a member and eventual co-chair of the San Francisco Dyke March from 2016 to 2021. I love that. I used to live in San Francisco, so I've been to anyways, that's awesome.
Yeah.
So she's working at the Pride Center is built upon a celebratory and affirming joy that ignited her passion for building community-centered spaces. Outside of the Pride Center, you can find Marilyn eating her way around San Francisco, hanging out with her dog, and watering her collection of house plants. Seems like we all have the joy of dogs. And so welcome Pearl and Marilyn to the podcast. I appreciate you guys joining.
Thanks. It's good to meet you. It's good to be here.
Yeah, excited. Thank you.
So this is our first three-way panel, you guys. So I'm super excited for that.
Whoa.
I'm excited that Marilyn was a co-chair for the Dyke March. I'm excited that we all have dogs, right?
Mhm.
And I'm certainly excited to be talking about, with other organizations in our area that also serve clients from this mental health capacity. And so why don't we go ahead and kind of get started and talk about like what is this what is the Pride Center and the history and
So I can talk a little bit about the history of the San Mateo County Pride Center. So the San Mateo County Pride Center is the first LGBTQ plus organization in San Mateo County. We serve all LGBTQ plus people, allies, and advocates throughout San Mateo County. So everywhere from Daly City all the way down to East Palo Alto and everywhere in between. We opened on June 1st, 2017. We were a program of Star Vista, who was our original parent organization. And we were located in the heart of San Mateo on 11th and El Camino until last summer, 2025, when our fiscal sponsor closed their doors. Currently, we're a partner project of the San Francisco Public Health Foundation, which is really great. They're an amazing organization as well. The San Mateo County Pride Center was established in 2017 as a beneficiary of the Mental Health Services Act, or MHSA, innovation project. So that's how we got our grant. So even before 2017, there were a group of commissioners in San Mateo County who thought there's a service gap for LGBTQ plus folks in the county. So they got together and they were able to get the grant for us to open in 2017. So yeah, even before 2017, the Pride Center was in existence, and then we opened officially June 1st, 2017.
And these services are so needed, right? Because for some reason, the government always wants to come after us, right? Try to strip away our rights, and the kind of the what would you call it, the discrimination that happens, right? So when we talked about, like, when I was reading Pearl's bio, right, kind of working with kind of marginalized or discriminated communities, right, this certainly fits that bill. And why people can't just like let us just like live our happy lives, right? Why they're always trying to come after us and, strip our rights and such, is beyond me. But so that even all the more all the more why I commend the work that you guys do to serve this community. And so, how would you say, kind of like, how does the work with your clients, kind of like from this mental health capacity, look like? Like, is it all like it's all outpatient services, I would imagine, right? And is it like individualized versus group, or like how does that look like for you guys?
So we've kind of experienced an evolution of that, especially within the last year with the closure of our parent agency. So as Marilyn mentioned, we had a physical space located in the heart of San Mateo, very accessible. And when our parent agency closed, we lost our lease to the building that was serving us for all those years, and we had to immediately pivot to mostly virtual services, but also thinking ahead to how can we continue to offer, like, we're all about community. How can we continue to offer that while our physical space is gone? So we partner with various local organizations and businesses to continue to bring on-site events to our community. And it's kind of been great to partner and learn more about the other organizations who serve the same people that we do. But
It
yeah,
sounds like a lot of outreach.
it's a lot of outreach. And then on my end, in terms of mental health services, yeah, we're continuing to make case management available. Therapy has kind of took a hit when we lost our parent agency. We lost most of our clinical team in that, and so we're pivoting to kind of lean into case management, lean into what services we can offer on site. Yeah. And right now we're restarting our therapy services with self-pay only. Due to everything that happened, we haven't been able to re-enroll with Medi-Cal, and Medi-Cal clients were the bulk of who we served originally in terms of therapy. So we're working on getting that started back up. But for now, we're offering self-pay therapy, case management. So case management is both virtual, and we're offering drop-in hours at the different events that we're hosting. So it's changed a lot. It's changed a lot in the past few years. It's continuing to change a lot, as you mentioned, due to the climate of our politics and the community's response to that.
Yeah, and I see too, like you guys also like work with LGBTQ plus youth, right? And even Izzo was Anna, who founded Izzo, right? That was her initial idea, is like she saw like this need to offer therapy services to the young ones, right? To minors. And so it's great to see that, that you guys are also working with, a wide variety of clientele, including the youth as well.
Yeah, definitely not like the intention. We serve everyone, but who tends to come to us are two-thirds of the population that we serve are transgender and or non-binary, and they're also youth under the age of 25. Yeah, but we serve all ages.
Nice. And so I think you mentioned, Pro, like you said, like there are some kind of resources that you guys provide to your clients. Like, what are some examples of like what those might be?
Yeah, so in terms of case management, it's myself and the case management intern, we will meet people where they're at for sessions of like, do you need help with housing? Do you need help with getting a job? Are you dealing with like legal issues related to your gender identity or your sexual orientation? How can we help you? How can we link services to you? We also have that people have taken advantage of this housing voucher that we offer, that has helped people get into housing, have people help like keep people fed. And so we have that available. Again, things have shifted. Like we used to have a drop-in center where people could just come and hang out, do their work, do their homework in a space where they feel safe. We don't have that right now, so we want to continue to make ourselves as accessible as possible. We also offer free gender affirming garments at our drop-ins, and we teach people how to use them safely and get properly measured and fitted, so that they can continue on their gender affirmation journey. Oh, and then gender affirmation in general. That's that people are just starting their journey and they're like, how do I get access to those services? How do I get healthcare? We're there for that as well. And that's a big part of what we do in case management. And legal name and gender markers. Like I want to change my name, especially with everything that's going on today. And all these different laws are shifting. How do we do that? So we help with that too, in terms of offering workshops and one-on-one support.
So glad you guys are there. Support people in this way, because it's in today's political climate, it's definitely. What would you guys say is kind of like some of the most exciting parts about your work? I mean, like you said, it's like kind of liking that kind of in person, right? Just because of you guys are having to pivot right around the structure and such, but still being able to provide these much needed services to clients. And so, what would you say are like some of the most exciting parts around working with clients? Or the community that you serve might be.
So one of the most rewarding and exciting things for me is just to see how expansive, diverse, how amazing our community is. I've lived in San Francisco for a long time. So for a while, I was just kind of used to who was here, the spaces that I went to. But it's really great to see who is in San Mateo County, because it's like Oakland, San Francisco, and then San Jose are kind of the big pockets or like big cities in this part of the country. But to see who is in San Mateo, like the creativity, the spaces that people want, the activities that we provide, it's great to see people come together and find each other. And it's just great to share space in like Pearl and I did an event a couple Fridays ago. So instead of Trans Day of Visibility, we celebrate a week of programming. And one of the programs was a hike at Maury Point in Pacifica. And it was a really queer group of people. And it was amazing to be in a beautiful place like Maury Point with our community members, just being in that sunshine, seeing like the beginning of the super bloom. Like moments like that are why I love working for the Pride Center and what I really appreciate about being in San Mateo County.
Oh, I love that. Yeah, especially kind of like it's like this sense of kind of like bringing the community together, especially for individuals who do feel kind of marginalized or oppressed or, um, you know, and oftentimes maybe even, may I dare say, like other ways kind of like discounted, right, even from their families. So as I know, even from my own history, right, it was, when I first came out, like I needed to find a new family and support, if you will, right. And so it sounds like this is able to kind of like be able to meet that need for people.
And I completely echo everything that Marilyn says. And to add on a more like clinical lens and perspective, it's really amazing to see the resiliency of the community despite all these adversities that come up, all these challenges. Just to see, especially the younger folks take a stand and make a place for themselves in an environment that doesn't seem to be supporting that. That's really, it's a hard work, but it's really heartwarming to see.
Yeah, and especially what was coming to mind for me too is like providing that safe space too, right, for people to come and know that they can feel and be a part of, right? Yeah, it's so important. It's so important, especially for you. What are some of the most challenging parts of the work, would you guys say?
So for me, one of the most challenging things is As much as I appreciate and love how big the county is and like how many cities and how many people are in there, it's a huge county and it's hard to meet everybody where they're at. We're also a smaller team right now, so our capacity to reach out like that is a little bit more limited. Thankfully, we have a lot of connections within the county, a lot of resources, and a lot of contacts that can help us reach folks that need these services. But I think the vastness of the county can be a little bit prohibitive and intimidating and challenging. But it is always really rewarding. Even if one person comes to an event and they take something from it, it always makes it worth it. So that challenge is a challenge for sure, but it is overshadowed by the impact and like how we can bring people in that need support and need community.
That's such the challenging part around this work, right? Is that we never really know like how we're being able, or are we being supportive, and how, and how we might be. And sometimes we don't always get that feedback or that confirmation from clients, right? We don't always get that. And so, but I had always thought, even when I was first starting to become a therapist, was that, what, even if there's one person that whose life can be changed or we can support in this particular way, even if it's just one person, it's totally worth it. So I can resonate with that part.
Yeah, absolutely. That's so true. And I think that's always important to remember, especially, with the mental health system the way it is, where we don't have enough professionals sometimes, especially to work in a more specific and specialized community like ours. It's hard to meet everyone's needs, like Marilyn mentioned, and sometimes the hardest part is like what may necessarily be best for like the center or for county or for whoever is in charge of us, might not be what's best for the clients, and that's always a hard like line to toe. Like there's so much we want to give. We're just like a group of really giving individuals, and we want to give it all, and sometimes it's like, okay, but we need to, take a step back and see what we can continue to offer and give everyone, despite limitations, despite funding challenges, or like Marilyn mentioned, like just capacity in general. That's always challenging, is continuing to meet the need that continues to grow, and then also continue to take care of ourselves and our own small space.
Yeah, that's true. Yeah. Those are really good points. And I was even thinking like this idea of trying to, like you said, with all the outreach that you're doing, right, and trying to meet people where they're at, and having, trying to encourage them to have access to these resources that you guys are able to provide, right? But also, just like any of us, right, we all kind of have our limitations, but it could also be, but the idea here is that it's driven by passion. That's what I was thinking when you were talking. Like, even though there just might be all these obstacles and hurdles, right, with government policies and right, at the end of the day, we're still passionate, and we're still here, and we're still fighting the good fight.
There is also just like what's happening politically. Our community members are afraid, and they are feeling discouraged, and that's really challenging as well. And we do our best to be there for them. We do our best to provide the resources and do our own research to see how we can help them. Like our name and gender marker clinic was really popular last year, but there's a lot of changes happening to like how trans, gender diverse, non-binary people can change their markers. So one of our responsibilities is making sure that our information is current. So things like that are challenging, and just being able to be representative, like we have representatives in the county, we attend all of these meetings, we just try our best to be there and like make sure that we have that we can provide that input and that information to the county as well.
Yeah, I can definitely see how that would be a challenge, right, with all the changings and policies, right, and trying to keep up on top of all that so that you are conveying accurate and up-to-date information. I can definitely see how that would be a challenge. Thanks for tuning in this week. Be sure to check out part 2 of our discussion with Marilyn and Pearl from the San Mateo County Pride Center as we discuss their training and support groups, upcoming events they have for the queer community, and how fun and community can benefit your mental health.